All right. A few people are still getting out of the waiting room.
Did you disable the waiting room, Shannon?
I did.
Great.
Yep.
Thank you.
There's somebody's birds chirping in the background, so
I
maybe
think
they're out.
that's
Maybe
me.
they're
I'm
outside
gonna
in the
mute
deck.
myself.
Well, that doesn't bother me one bit. I think it's funny.
Yeah.
It's not.
And the church bells.
Yeah.
I'm going to go ahead and get us started, I
Okay.
think.
Go
Good
ahead.
morning, everyone. This is Lauren Peretti from Housing Innovations, and thank you all for joining us today. I'm joined here from the Housing Innovations team by Shannon Quinn Sheeran and Andrea White, and we've also got Brenda Earl on the line, and a number of other guest speakers that we'll introduce as we go along. Before we get started, I just wanted to do a couple real quick housekeeping things. Shannon will get the slides up in our chat box in just a moment, so you can download today's slides directly from the chat box. They will also be posted to the CT Boss website at www.ctboss.org by the end of the day today, as will a recording of today's session. So feel free to access them there as well. Everyone is muted. You can unmute yourselves, but we ask if you're not speaking to please keep yourselves muted so that it cuts down on any background noise. So our topic for today is providing trauma-informed care in the midst of a crisis. And I think tragically, that topic seems even more apropos today than it did 2 weeks ago when we first started to plan today's session. So when we first started to plan, we were thinking about the crisis, obviously, of the COVID pandemic, and in the last 2 weeks, the crisis of racist violence, and in some cases a violent response by the police to protests. There are now multiple crises that have become even more evident that the folks that we serve and the communities that we serve and many of our staff are dealing with. And so wanted to just start today in light of all of that with a brief moment of silence in honor of all the folks that have lost their lives to COVID, as well as for George Floyd and Ahmaud Arbery and Breonna Taylor, and all of the far, far, far too many people who have lost their lives due to racism in our country. So if you'll join me for a brief moment of silence. Thank you, and thank you for everything that you guys are continuing to do every day, to deliver critical resources and life-saving services to the folks who are most impacted by the pandemic and most impacted by racism in our country, whether that's because of police brutality or it's because they're poor and homeless and don't have access to the kind of decent healthcare that our country, with as wealthy as we are, should be able to provide to everyone. So, you know, I think you guys are all trying simultaneously to both, you know, manage these crises in your own lives, as well as help the people that you serve, you know, to survive and thrive, despite all of the many traumas that they have lived through and are continuing to live through. And I'm gonna move us into our agenda, but we will certainly talk more later about how we can do our best to try and ensure that the services that we provide are trauma informed. So here's our agenda for today. I'm going to turn it over in just a minute to Brenda, and she's going to do a welcome and just quick updates from Demas. We've got someone from CCH on the line who will be giving us an update, I think, on testing. We've got, I believe, Lee from DOH on the line who's going to be giving us an update. We've got a special guest today, so Robert Rodriguez from the Social Security Administration. Thank you very much, Robert, for joining us. We appreciate it. He's here to talk today about how people can help to ensure that folks are continuing to get what they need from SSA during this crisis. And then we've got Andrea White from the Housing Innovation Team and Lori from CHD that are going to be talking about providing trauma-informed care during these crises. And then Shannon will lead us through a couple resources and some next steps. So with that, I'm going to turn it over to Brenda.
Great. Thank you, Lauren. I just also wanted to start out with a thank you to everybody. Just thank you so much for your continued dedication to people experiencing unsheltered homelessness. I just ditto everything Lauren said. It's just such a thankless job, and you've all been out there working so tirelessly, so I thank you. I also invited a few of our SOAR case managers around the state to join this call, so if you're out there, thank you for joining. We are pushing kind of towards, if you've heard this, 1,000 homes, which is to really ramp up housing people from their sheltered situation, whether it's hotel or shelter, as well as their unsheltered situations. So because there's been some stimulus dollars that have come into the state, we're using that to really ramp up housing. So please just remember, as PATH and outreach workers, it's just for you continue what you're doing, keep housing people from their unsheltered situations. And I'm so happy to have Social Security on with us today, because that will really help, whether it's through SOAR or going to helping your clients just access Social Security Administration to hopefully gain some income through Social Security, if that's the best way for them to have income to get housed. Also, just one last quick thing. Demas is going to continue with our regular quarterly statewide meetings. So our next outreach meeting is going to be on June 16th. From 1 to 2, we did send those invites out, but if that is something you would like to take part in and you haven't gotten an invite, just please shoot me an email and I'll get you an invite. All right, and now I think we're on to local resources.
Thanks, Brenda. So the first update we've got today is from CCH, and we've got, I believe, Dana on the line with us. David sends his apologies. He wasn't able to join us, and Dana, we thank you for being here in his place.
Yeah, thank you guys so much for having me today. So these are just updates from David Gonzalez-Rice. And from what I heard, the group was just very eager to learn more about statewide testing. So to be frank, that effort is underway, but it is not centrally managed yet. The state so far is looking to local communities such as CANs and healthcare providers to really find solutions and set priorities, with the state playing a backup role. So today there is going to be a CAN meeting to begin a statewide framework. So on behalf of the CANs, I believe Kelly Fitzgerald from Greater New Haven CAN is convening a planning conversation on testing in the afternoon, I believe, after this outreach call. And from what I understand, that agenda includes developing a statewide framework for testing protocols and priorities. And David will be participating in that call and intends to ask how to access for unsheltered clients, and that will be addressed. And then lastly, CCH is asking input from the outreach providers on this call on the following questions that you can see on the screen. So they are: how are existing testing locations accessible to your clients? Is mass testing dozens in a day feasible for your clients? And what specifically would ensure testing access? So David and I are really encouraging that the outreach providers, again on this call, just contact David Gonzalez Rice. His email is at the bottom of the screen, with their observations about availability of testing in their community, and to just send him your thoughts and inputs on those questions, because that would be greatly appreciated. And that's all the updates from CCH.
Great, thanks. So just as a quick reminder, oops, sorry, I think I accidentally muted myself for a second. Just as a quick reminder, if folks have questions, probably the best way to ask questions, if you have questions for any of our presenters today, is to just use the chat box at the bottom of your screen, and we'll monitor that throughout the course of the webinar today, and answer any questions that we see pop up there. So thanks, Dana. I am going to now turn it over to, I believe we have Lee on the line with us from DOH. Lee, are you there? I can see you in the... I can see you in the participants, but it doesn't look like maybe you've connected to audio, Lee. I'm not sure if you're having technical difficulties.
Oh, I think, can you hear me now?
Now we can hear you. Hi, Lee.
Something with me. Sorry, I always try to sync my phone in the computer audio. So thank you for doing that, whoever unmuted me. Good morning, everybody, and thank you for giving me some of your time just to do quick updates today. I can't remember, these days are blurring together, so I can't remember what the hotel update was last time I spoke with all of you. But the latest, as I hope many of you already know, is that the state has gotten approval to be able to extend hoteling as a way to keep our shelters decompressed through the end of June. So CANs and some of our shelters are starting to think about what their protocols will be as we start to, as we anticipate transitioning people back into shelter settings as of July 1. Many of our shelters are going to be operating at a reduced capacity in order to be able to maintain the social distancing practices as recommended by the CDC, of course. And that's really going to vary region by region based on the physical structure of the shelters in any particular area. We do anticipate that we will need to keep some hotel space around the state for people who do test as COVID positive as a way to keep them safe. And so we are currently working on what those plans will look like, but nothing is definitive yet at this time. And as Brenda mentioned, I just wanted to piggyback on the 1,000 homes effort. And really, you know, the intent is to ensure that we're able to keep shelters at a reduced rate, and that we are able to ensure that we're not discharging people to the streets who have been using our hotel system over the past few months. And so really the effort is to get people housed because it's the right thing to do. It is always the right thing to do. But especially now, it is, you know, of our particular concern that people are in their own homes. And so anything, of course, that you and your staff can do to contribute to those efforts. We are adding rapid rehousing capacity to each of the CANs through both staffing and additional rapid rehousing rental assistance availability. And so in total, it will be about $2 million in rental assistance across the state that is going to be available to communities. And so we are working on what those allocations will be in each of the CAMs. So I think as always, we are continuing to seek housing resources to be able to contribute to these efforts and also to secure the support services to pair with the housing resources that are coming online.
Thanks, Lee. Again, if anybody has questions for Lee or any of our other presenters, please feel free to put them in the chat box. And I am going to turn us over to Robert Rodriguez from the Social Security Administration.
Good morning, everybody. First of all, thanks for having me on the call. I kind of think we have a good connection with everybody across the board. I do public affairs for the agency. I'm always open to having, you can utilize me as a resource for anything that's Social Security related. I work in the New Britain field office. I've got some staff members there that are extremely technical. I think for the most part, I can answer any questions that you toss my way. But should something come up that you need some sort of a hand with something or maybe some guidance or an answer for something that may be a little tricky, if you email me, then what I end up doing is I can reach out to the New Britain staff. And I've got two people who are extremely technical, so we could, kind of answer your questions. When I was contacted by Brenda, Lauren, and Shannon, I said I'd be glad to come on and, give a brief presentation. I've got a slideshow. There's a couple of slides that I want you to just to look at and just to kind of give you an update in terms of what we're doing on the Social Security side of things. So if you want to go to the first slide, Lauren. So this is our website at socialsecurity.gov. Some people mistakenly go to socialsecurity.com, and that's one of those fly-by-night operations that you definitely want to stay away from. But if you go to socialsecurity.gov, we basically have everything from A to Z. We're very transparent. We talk about all the programs that we have, such as retirement benefits, disability benefits, the SSI program, Medicare, and survivor benefits. At the same time, we have just a huge host of information that's on here for like field office addresses, some things that you may want to do, not only for yourself, but also for the individuals that you're helping out. So if you go to the next slide. So on the next slide right here, somebody who's applying for benefits and, for the outreach workers, if you're touching base with somebody, you could, again, these are the three options. Now, the first and the principal one's going to be online. At our website, you can apply for disability benefits. This is the fastest way to get that done for anybody who's out there on the outside. And we're looking not only at individuals who are homeless and have conditions, but this kind of basically applies across the board to anybody who, even down to children who are born prematurely. Parents can take and apply. With COVID-19 happening right now and people passing away and people becoming ill, again, survivor benefits is another option because we do cover everybody kind of across the board, provided you've worked and paid into it. So this is the principal thing that our district office managers tell me to let everybody know. Online is technically the fastest way to do things. Our central office in Baltimore keeps on updating the entire website, just making it easier for individuals to access it. And especially now. Right now, our principal thing is because our field offices are closed to walk-in traffic, not only here, but just across the country. The principal focus right now is by phone and also, again, the online services. Our toll-free number that's listed right there is open Monday through Friday from 7 in the morning to 7 at night. And a person can contact that number. An appointment can be set up with the local field office of the area or the town in which the person resides in. And, you know, what we can end up doing is we can call you Monday at 10 o'clock. We can, you know, touch base with you Wednesday at 11 o'clock in the morning. A person does not have to actually come into a field office. And a person at the end of an application, the individual's verbal yes constitutes his or her wet signature. So, you know, in that case, you know, they're pretty much all set. But this is one of the other mechanisms we want people to utilize. And, you know, lastly, where it says at our office, it's not an option at this time because the agency still has to figure out a lot of the logistics, how many people are going to be allowed into lobbies, if there's going to be barrier walls. And so we don't have any word in terms of when we're actually going to be heading back into the field offices. Okay, next slide. So, you know, a lot of the population, maybe with homeless, a lot of times they may have, you know, issues. It could be some medical issues. It could be psychiatric, it could be a combination of the two. But again, you know, the disability option is open to any and everybody for the most part. The exceptions would be somebody who's over 65 or somebody who's hit his or her full retirement age, because at those 2 points in time, we no longer consider a person to have a disability, if you will, even though he or she may physically have one. But again, this allows a person to online applications. The workers can do the applications for the individual and they can assist. But ultimately, the signature electronically would have to be of the individuals. Okay, next slide. The requirements on our side of the fence for somebody to be, you know, deemed to be disabled. Our rules are specifically in the Social Security federal side of things. Anything with the state of Connecticut, for example, if somebody applies to get Title 19 or they're getting benefits from the state, that does not automatically cross over to us. But if you take a look at the bullet points, a person does have to have a condition. It could be something physical, it could be something emotional, it could be a combination of the two, something that's going to limit the person's ability to do what we call substantial work activity. The disability is expected to last for at least a year or more, or sometimes result in the person's death. And then we do take a look at the person's age, their education, and their work history. This is difficult to get at times. The one thing that I always tell an individual is that the more complete picture you give us of what your situation is, like, you know, what's my condition? Why does it keep me from working? Have I been to any hospitals, doctors, clinics, psychiatrists, psychologists? We would need information like that. What kind of medications are you taking? What kind of work history have you had? We in the field office, we basically do what's called the non-medical part. We find out whether or not you have enough work. Do you meet some of the requirements on the non-medical side of things? You know, what's your address? Do you have any kids or you're married? Because we always look to find out whether or not there is going to be some sort of eligibility, not only for you, but somebody, you know, in your universe, if you will. Next page. You know, generally, it takes for a disability application at the initial outset, anywhere between 60 to 90 days. The field office staff do not make the medical determination. It's basically the medical portion of the file is sent to what's called a state disability determination service. They are a state agency that has a contract with us, and they have teams of doctors, psychiatrists, psychologists, labor specialists that look over the individual's overall record. You know, years that they worked, how much they paid in, what was their, you know, what kind of job history they had, what's their medical condition, and they're the ones that ultimately make the decision. On our website at socialsecurity.gov, we have one specific page that's dedicated completely to disability, and it covers everything right there. It's very transparent. Also in our website, we have what's called our POMS, which is our Program Operating Manual Service system. It basically says these are the guidelines that we follow So it has everything in terms of, how we figure out a person's disability. And in that one page with all the connecting links, it's going to have everything right there. And I usually tell Lauren, I tell everybody, don't listen to Cousin Eddie or Uncle Joe. Your best bet is, get it straight from us, get it directly from the horse's mouth. It's important to know that once a person does apply, that if the person is denied, you normally have like a 65-day window to file an appeal. And then you can do this appeal now via the internet. You can do it online. That never used to be the case, but this makes things a lot faster. And the principal thing that I always tell the groups that I talk to is if a person gets denied, to make sure that he or she does that appeal within the 65-day time frame. Because if you let the 65-day time frame expire, what's going to happen is it's going to be like erasing the blackboard, and you're going to start all over again from scratch. So you want to continue the case and make sure everything is, still set up. You can go to the next slide. One of the bigger pushes that we have for everybody to kind of take note of is what's called creating your My Social Security account. The My Social Security account is applicable to you. It's applicable to your other half, to your significant other, to your family members. This basically allows you to get your Social Security information online within about 10 or 15 minutes. And so, a lot of times nowadays, a lot of people will have, cell phones. Some of them, I think maybe for the most part, may have internet access. And, that being the case, the person via their phone, their cell phone, can go to our website. They can create this My Social Security account. You have to basically answer a couple of questions. You create a username, you create a password, answer a set of secret questions, and then you're in. And then again, this gives you your personalized information. It shows you the years that you worked, how much you paid into Social Security, how much you would get for retirement, how much you would get for disability. If you were to pass away, how much your survivors would get. And, the principal driver behind this is to make sure that you, again, can look at your information. And then this does open up the door for anybody who, again, who has an online account and they have the case pending with us. They're able to check it via this system. So basically right in the palm of their hand, this is something that you could do. The stated, we are now one of 44 states where if you have a My Social Security account set up, then you can request a duplicate Social Security card through our website. You do not have to visit a field office, as was the case in the past. And so we just kind of want everybody to try to take advantage of that as much as they can, because it's really one of the keys to getting the online services and then allowing you to be mobile. You don't have to actually go and visit a field office. And again, the whole situation with field office is up in the air. I think the last slide, Lauren. So this is the listing of our 15 field offices here in Connecticut. Again, I know, you guys are a statewide coalition. We connect with everybody. When you were talking about the cases of the homeless and them, getting apartments, I've been familiar with that. I've seen some situations. I've helped out a couple of workers who've called me through one of the cans to say, hey, Rob, this person's transitioning from a homeless shelter and now they have an apartment. The fact that they ended up getting that CARES impact money, that stimulus money, was a help. But if a person does get approved for, disability benefits with us or the SSI benefits, if they don't have a bank account, they can have their money put on what's called a Direct Express card. And then again, it's like an ATM that you can utilize anywhere. But I think that's kind of most of the information that I want to give you. That number one, to visit the website. Number two, you can utilize me as a resource. I'd be glad to try to help you out, to kind of give you some guidance. And, for the workers that are out there, to me, it's a good thing to just touch base with individuals and just find out, hey, what's your income source? Have you applied? Do you have a disability? To touch base with us. And then, we could possibly give that person some help. Sound fair? I'm open to questions too, so thank you.
Sounds terrific, Robert. Thank you so much for your time today, and especially thank you for offering to serve as a resource moving forward. So
Sure.
Shannon, I'm wondering if we can get Robert's email into the chat box so that folks have it, or Robert, I don't know if you know, you could put it up there yourself.
Yeah, I'll do that.
Okay, great.
Sure.
And then also maybe we can add Robert's email into the slides before we post them so that everybody has access to Robert's email. And that's a generous offer, and we thank you for that, Robert. So I'm going to move us on. If we have, again, if you have questions for Robert or for anyone else, please put them into our chat box. All right, and so now we're going to move into our discussion about how we can ensure that our services are trauma informed, and I'm going to turn it over to Andrea White from the Housing Innovations team.
Here we go. Thanks, Lauren. Can you hear me?
Yep.
Okay. So let's go to the next slide. We're going to really give you guys a brief overview. We're going to focus it on sort of what makes a trauma-informed approach. And Lori's going to follow up and talk about the specifics in her agency. I think the most important thing to remember from this is that trauma includes three things. It includes events. Notice that's plural. What the person's experience is, and what are the effects. So that a person's own experience is going to affect the way that they respond to trauma. And we also have to remember that some trauma is ongoing, and that this COVID crisis, which has been going on for what, 4 or 5 years? It's a joke, y'all. Seems like 4 or 5 years, but is really wearing people down. And it affects a lot of things that make an experience traumatic, which is people feel like they don't have much control. They're scared all the time. And these things are going to re-traumatize and traumatize people. So one of the things that we need to do is make sure that the way that we respond and the way our programs are structured can really respond to that. So next slide, please, Lauren. These are some things that SAMHSA, which is Substance Abuse Mental Health Services Administration, which is out of HHS in the federal government, is talking about how to respond to trauma. And this is based on evidence-based and promising practices. So we're going to go through them one by one. So I'm sure you're relieved to know I'm not going to read them to you. Okay, let's go to the next slide. So one of the things is that people can't relax, and people can't have a hard time processing when they're scared all the time. So one of the things we want to think about is how to keep people safe. Right? We want them to be able to think clearly, make a plan, feel some kind. We want to create a structure that's dependable, but also predictable. So people can decide how they're going to come into this structure, how they're going to follow this structure, but the structure remains consistent. We also want to provide access to things that keep people safe, and that includes masks, but it also includes alternate means so that people can help them feel safe, including things like helping people to space themselves, giving them opportunities so they can isolate, like the hotels. We're sure that everybody feels safe, and remember that the staff or all of us are likely to be trauma survivors too. And so we really want to make sure that safety is prioritized. We also want to make sure that people have someone to talk to, which often makes people feel safe. And for what's going on now with the whole movement and the protests and what's going on, we want to help people, if they're going to participate in that, make plans. But we also trauma that this is bringing up. So I'm afraid of police. Okay, let's talk about how you talk to a police officer, how you get control of the situation, what are your rights, what are the expectations. We want to have these conversations. What if I go to a hospital? One of the things that we really know is particularly African Americans are less treated for pain in hospitals. So how do we make things possible so people can use the systems that are available to them? We want to have, And we also want to avoid blaming people if they're not doing it perfectly. You know, if people mastered things every time we said something perfectly, well, first of all, it'd be a miracle. But second of all, you know, I mean, it just is not going to happen. So that people we work with are going to have problems with stuff. You've heard this. Let's talk about safety. People wearing masks. Some people are reluctant to wear a mask. So because it de-identifies them. So let's talk about that. Let's talk about what else would keep people safe. And let's talk about things like decorating masks or do something, put your name on them too, but we want to have these conversations. Okay, next slide. That was the big one, by the way. I am going to go through this pretty quickly. Want to make sure people can trust us. We want to include, we want to be reliable. We want to show up on time. We want to keep our promises. We also want to help people develop confidence and competency. It's one of the core elements of motivational interviewing, but it also helps with really trauma. We want people to be able to want to listen to what's important to people and connect that to the long-term goals. And we want to prioritize safety, but we don't want to necessarily prioritize a specific remedy. We want to talk to people about a group of remedies so that people have more choice and that people's own feelings can be looked at. Okay. Let's go out. Let's go to the next one. Yeah. We also want to provide resources. We want to give people the same information we have. We want to provide as much educate a reasoned decision. What we want to move away from is those kinds of reactive decisions, which trauma can exacerbate, but also the times can exacerbate, right? People can be very reactive. We want to give them as much education as possible on the pros and cons of certain issues and what's going on. We want to debunk myths, and we want to give people a chance to process. In other words, take a breath. We want to talk about things that mean something to them, and we want to be regarding what people's answers are. I'm safe from COVID. I'm going to stay 10 feet away from everybody. Okay, so that might be a good system, and there's certainly things that back that up. Let's talk about how you would put that into practice, right? Let's not just disregard. That's not going to work. How many times do I have to tell you to wear a mask, right? It's hard to resist. So we really want people to pull that together. Okay, let's go to the next one. We want to use as much peer support as possible. People's own experiences can really influence this. We want to be prepared to ask follow-up, ask for suggestions. As much as possible comes from the people we serve, the better. We want to look for things about comfort. Helping people find a little bit of comfort helps them to take a breath. We want to play out the choices. We want to expect them. We want to help people with an informed choice. We want to talk to peer specialists. Importantly, remember the peer specialists need some sort of supervision and support. It's hard in a crisis to separate out your own ways of doing things from other things. It's hard anyway, but it's harder in a crisis. We want to help people to do that. We also want to give people a chance to use structured peer support, things like online AA meetings or warm lines as much as possible. And we want to just give people a chance to move forward gains, even in the middle of this crisis. Okay, next slide, please. We want to pay a lot of attention to cultural, historical, and gender issues. This is coming up loud and clear. You know, what are the expectations of them? How do they use systems? We want to help people with that. We want to talk about it, and we want to support their own reality. Yes, Americans have had trouble with the COVID crisis, largely because large numbers of African Americans are dying during the COVID process. Why is that? There are probably a bunch of different reasons that leads to, including the fact that they're more likely to be frontline workers. and have more exposure. But we're going to talk about that. We're going to talk about how people can individually decrease their own risks. We're going to talk about why people might have misconceptions about different things due to a historical pox epidemic with Native Americans. They were given blankets that were infected. Talk about Tuskegee. Talk about everybody being killed. There's been a lot of violence against African Americans, and some of it has been through the criminal justice system, not just the police departments, but also the prisons. And people want to talk about that. But there are also stories emerging through this epidemic of things like African American women or more is that they have a hard time being listened to. We want to acknowledge people's own reality and help them use the systems in a way that they're comfortable with. We want to also understand gender. It changes the way that people are perceived and changes the way that people may look at the process. Certainly there are not a lot of examples of gender affecting the way that people get services or don't get services. We want to have the convergence and want to help them problem solve to move forward to get the things that they need either within that system or with advocates through that system. We also want to look at the experts, listen to the experts, and use peer support in this case and really listen to what people think will be effective. Okay. So if you go to the next slide, there's some resources that talk about trauma. And for that, I'm going to turn it over to Lori, who's going to talk to you about specifics.
Everybody, my name is Lori Walling. I'm the Assistant Program Director for Center for Human Development. I aid in running our PATH program, and we service Greater Waterbury and Litchfield County with one outreach worker. This is my first time presenting on Zoom, by the way, and I'm very interactive, so this is really, really weird.
Oh, yeah.
So I feel that the info that I have is basic, but it's been working for our outreach attempts, especially during COVID. Everybody was really nervous about how we were going to run the programming because of COVID, but we just kept trucking along. Other than the fact that we're working with clients that have dealt with trauma in their past, COVID in itself is a trauma, and it really has set a lot of our clients backwards. In reviewing the 6 components from Andrea's slides, I'm going to focus on 3 that we changed the most, and that's with our approach on how we're actually approaching our clients. Already, these are things that we all are probably doing. We just kind of took these 3 components and we stepped them up. And to go over was safety. And the biggest thing that changed within our agency with safety is PPEs. So we actually have gone a little overboard with it, always carrying masks with us, always carrying gloves, but it's not just for our staff, it's also for the clients. So if we're going to engage with them, we're going to, keep our social distancing, our 6 feet apart, but we're also going to say, set down a mask and some gloves and say, here you go, because we want them to feel safe in order for them to interact with us. Let me see, where am I? So when we're interacting with our clients, it's not the same. Giving them the gear is great, but we also want our clients to be overcoming their barriers, a lot of their barriers with their trauma. They've lost a lot of their resources, and we're trying to compensate for that by being those workers that are out there. For example, we have one client who respites at a barbershop that their friend owns. Well, that's gone now. So now we have Nico that they can confide in. And even though that's not a physical respite, that is still a personal respite where they can still have their needs met. They can still voice their traumas. They can voice their concerns. And we're just going to use a lot of motivational interviewing, redirection, and assurance for them. The second one I have is trust. And in this field, we all know it takes a lot to gain our clients' trust, especially when they know that we can go home and they have to stay outside. What we do, which is kind of, you guys will, take something out of this. We make baggies. So whenever we come into interaction with a new client that we might be trying to get into the program, or if someone just says, oh, hey, I need a toothbrush, we have baggies in our cars, and they're full of either hygiene products, food, water bottles, and we use that as a point of engagement. Okay, so you need a toothbrush. Well, here's a whole kit for you. Upon our first meeting with them, they tend to come back for more. How we've ramped it up with COVID is we actually go out to the sites, and even if they're not at their tents, we'll leave a baggie there. Each baggie has the products in it, but it also has resources. We've made a resource guide about our hospitality center in Waterbury, about the PATH program, Gathering Place in Torrington. It's all info that they can use in the future. They can hold it on them. Plus we have Nico's, our homeless outreach worker's card, his business card in it. What we do is follow up after that. So the second part of trust is consistency. We have found that when you go back at the same time, same place, and that baggie's gone, but they're not there, we're gonna leave another one for you. 3 times, 4 times, however much it takes, because we found that after a few tries, they're gonna come out and finally meet with us and see who we are, like who's leaving the stuff for us, how are you going to help me? So that probably is the biggest change, where we were going through these little baggies, maybe 20, 30 a month. We're probably going through 100, 150 a month now. And then the last one is collaboration. So CHD as a whole, we've always loved to collaborate with the community, with other providers. What has changed with the sharing of resources since COVID has been the providers have really stepped up to where we only have meetings once a month, once a quarter, every other week. We're finding that we're talking with them a lot more. Our outreach worker probably daily with the other outreach workers, especially around Waterbury area. It's really made it easier. We've found that we're actually having a little bit more engagement than we were before. Keeping in mind the trauma base that COVID has on our clients. Everyone says this, and I really hate this, but we're in the new normal, and this is how I think we're going to be running things for quite a while now with our outreach, with COVID, and especially facing trauma. No problem.
I'm just gonna pause for a minute here. We do have about 10 minutes remaining. And so just pause for a moment to see if anyone has questions or wants to chime in with other things that your teams are doing to help ensure that the services are trauma informed during this crisis, these crises. Please feel free to, I'll just pause for a minute to see if anyone wants to, has anything they'd like to ask or say.
Hi, I've been waiting for this opportunity for so long. Hi, everybody in the room. But I especially wanted to give a shout out to Andrea, my friend in New York, holding it down. Thank you so much. I was like, I wonder how she's doing with everything going on with COVID-19 and then with all of the protests going on. So I'm glad to see you. I think it's great for us to have the Zoom because we're able to build the relationships and talk to each other and encourage each other. So just wanted you to know I was thinking about you, and I hope all is well. That's it. Bye.
Thanks so much. All is well in New York. All is well. Too, because there's been a lot of action around Connecticut, right? And you all are starting up again. And the other thing is you've got some looming deadlines, right? One of the things that somebody had asked us was about, what about people who haven't been paying rent?
Yeah, that's always a big concern, especially here in Waterbury with the landlord-tenant situations that come up. And CHD, my supervisor's on the line. She's a great stickler reminder about the deadline. So I'm glad you reminded her of that in the Zoom call.
But also we've got to make a plan, right? What's available to pay back rent? What can we make a a deal with the landlords. There's an extension under the federal benefits for things that are federally assisted housing. We want to look at all of that. Is that something that people are interested in? Yes? Okay. So that's something we're going to follow up on. Yep.
Hey, this I do think that there, for anyone who takes part in the Reaching Home campaign, I do believe that there are some groups talking about that.
Great.
Around the eviction prevention. I also just wanted to take a minute and thank you, Lori, for presenting. I really appreciate that. I think we've been trying to kind of rotate out the path providers to kind of join in the call and share your information. Sometimes when we have these calls and we hear what everyone else in the country is doing, it sounds so great, but then we look, well, how can I do something like that near me? And I, their own peers, you know, all of the great work you're doing. So thank you, Lori.
No, thank you.
No, we appreciate it.
Andrea, I have a comment in regards to the landlord tenant and the eviction. So my concern and my question is, I know there are resources that are available for those kind of services. However, with the courts being closed, is it realistic for people to feel like they can actually get a solution or find us in court and the resources that are available?
Okay, so that's an interesting question. So it's my belief, well, let me not say what my belief is. We should check this out, right? If the court is closed, can they evict people is really the problem. So let's make sure what the processes are gonna look like, and we can do some research on that and get back to you guys.
Hey, Lauren, this is Rob. I wanted to ask, first of all, Andrea, thanks for your, Lori, I wanted to ask you, with the outreach workers, you know, leaving these hygiene bags, do you guys ever put any information in there, maybe as to who,
good idea,
you know, who can they contact? Because, you know, on the Social Security side of things, even if they had somebody who has a, you know, an issue and they say, oh, you know, let me just take a look at this and see about possibly contacting Social Security. I mean, we've got these, oh my God, I can't even think right now. It's a little like, I'm not going to say business cards. Can be utilized by somebody who does pick it up and say, hey, you know what, let me call and see. Because usually, a lot of times word of mouth, you know, somebody's getting a benefit or, you know, how'd you do that? Or, you know, I've got nothing, I've got conditions. And, you know, with all the trauma and the situation, you know, impacting people, if they touch base with us, I mean, you know, we're there to try to help out.
So we don't actually have the Social Security information, but that is a really good point that we could, and if we could obtain those little cards, that would be wonderful. We'll put them in. Our worker is SOARS certified.
Okay, so perfect. Yeah. If they have any SOARS meetings around, I mean, obviously we can't, you know, we're limited and we can't attend, but I'm always open to attending a meeting if they ever have a SOAR meeting, you know, via Zoom, and welcome for your first time. But I can reach out to the district. I have a stack of them, I believe.
Perfect.
That I can, if you can give me your contact information, I'll have them sent somewhere so you can utilize them. And I'll touch base with my other public affairs people.
Okay, thank you. Excellent.
You're welcome. Yeah.
I
heard they were doing that in Boston.
This is Brenda with Demas, Robert. I'm the state SOAR lead, and I actually do keep the contact list for SOAR case managers throughout the state, and we do meet. So I can certainly add your information to our contact list.
Love it. Thank you.
That'd be great.
Yeah. I'm in place. I've been with the agency like 35 years. My mother gives out my phone number because I get random phone calls from people. But I don't turn anybody down. You know, people ask me questions like in the store, family picnics and parties, but you know, I never turn anybody down. So I'm always game for questions and to help out. So, but thank you.
Thank you.
Oh, we.
either questions for any of our presenters or anything you want to say about what you're doing in your outreach team to help ensure that the services are trauma informed, feel free. We've got a couple more minutes. I'll pause briefly, and then if we don't have anything else, I'm going to move it on to Shannon. Okay. So Shannon is going to lead us through our next set of slides.
Yeah, I sent out an email earlier this week about the SafeLink webinar, which is this afternoon, but it's on free cell phone services, cell phone plans to income eligible people. So I just wanted to bring that to your attention. And there's a register here link if you're interested in attending. Next slide. More resources. There aren't too many updates. I would refer you back to the slides for Andrea for the trauma-informed care information. And then there is a link here for additional cell phone information. Next slide. Resources again. So if you're looking for any information whatsoever, I'm sure it's out there on one of these resources. The most important thing I want to get to are the upcoming meetings. Next slide. So as of right now, we have another meeting planned for Thursday, June. I'm looking at, this is the case conferencing meeting for Thursday, June 11th at 11 a.m. that Andrea's been leading. So if you're interested, that's going to happen a week from today at 11 a.m.
Shannon, can I just say something about that?
Absolutely.
Really, what we've been talking about is, and that's fine, whatever's working for you guys. So I would encourage people, if that's helpful to you, to tune in and talk about different issues. And what I'd like to do is get a list. And it sounds like that part of the issue is to coordinate with some of the resources Brenda had talked about, you know, what about people who are behind on their rent? You guys also want to know, because probably some of your clients are behind on them. You also want to know about how they can be helped, because it's likely they'll come back to their outreach workers, right? I mean, I was an outreach worker for a long time, and those are the clients that stuck around, came back 30 years later and said things like, where you been? So that those are the people that we want to make sure can ask you the questions.
Thank you. And then we have one more outreach meeting, this Zoom meeting, outreach meeting planned for Thursday, June 18th, again from 11 to 12. The same Zoom contact information as this call today. So we're going to meet afterwards after this meeting today and get you out any information on that meeting coming up. That's all I got. Thank you all for attending. It was great to see your faces and hear from you. Go ahead.
This is just our contact information. So, you know, if you need resources out there, so if you need resources and you're having trouble locating things and among the gazillions of links that we're providing you, please feel free to reach out to any of us, and we can help with that. Like we said, we'll add Robert's email to these slides so that you can also reach out to him with any questions related to Social Security. And always, we want to make these helpful for you guys. So if you have ideas about topics or things that we can do to make these presentations or these sessions, hesitate to reach out and let us know. So thank you for your time today. Stay safe, take good care of yourselves, take good care of your clients, and we will see you again, some of you in a week for the case conferencing session with Andrea, and some of you hopefully in 2 weeks. Okay. Well, everyone.
Thank you all.
Thank
Be
you.
well.
Thank
Have a
you.
good week.
Thank you guys. I appreciate it. Have a good one.
Sure.